microsurgical kit. The microsurgical kit involves the instrumentation here, and then a wide variety of clamps, and you have sutures and other bits and pieces that help with the microsurgery. So we're going to first start off with the instruments. Okay. So now going on to the microsurgical instruments themselves. So we've got the curved scissors, and these are used for tissue dissection. Okay. We've got the straight scissors, and the straight scissors are used mainly for suture cutting or cutting the vessel themselves. You get a nice straight cut. So the curved scissors are more used for getting rid of adventitia, but there are two kinds of scissors, and you got to use what you want in the appropriate manner. The clamp applicators, and they're to actually, if you take a clamp here, they fit on there, and they're to open and close the clamp. For more small microvascular clamps, you've got to use a clamp applicator, not your fingers, because otherwise you'll destroy the spring mechanism on the clamp. And they tend to have an artery clip, and the artery clip actually is useful when you have a double clamp like so, and you put your vessels, and to bring the vessels, approximate them to the optimal position or spread them out. So the artery clip works very well for that sliding mechanism. A nice little curved artery clip is quite useful. And then we've got the fives, which are the jeweler's number 5 forceps, and they're straight and they're a bit sharp on the ends. And it's because they're sharp, you cannot put them into a vessel because you'll damage the intima. Never ever put it into a vessel. You've got to use these things called 5As, and the vessel tips, as you can see, are a little bit different. They're a bit rounded if I do that, so they're less damaging to the intima, and to make it easy, they tend to have a curve on them to essentially differentiate it from that. So that's a 5s, and these are called 5As because they go into the artery. This is another pair of 5s, and you can see that it's got a bit of a rounded handle, but that's for surgical preference. And then you have the needle holder, and there are many types of needle holders. This one does not have, if I move this along, this one doesn't have a ratchet. Some of them have a ratchet. They all have a fine tip, and some of them are a bit more curved than others. But in general, this is the standard sort of microsurgical instrument. As I said, there is some degree of variation. They're shorter, longer, different types of handles, and some disposable, some not disposable. Okay, so we now go on to the clamps. Right, so we're going on to the microvascular clamps. The features of all these microvascular clamps that have in common is that they're non-crushing clamps, and they're quite delicate little instruments. Most of these, with the exception of the really big ones, need to have this clamp applicator to open and close the clamp. So you can see that the clamp applicator fits like that into there, and it opens and closes the clamp. Okay, now the clamps can be divided into the single clamps, which just clamp onto the vessel, and the double clamps, which, let's take this big one as a demonstration. You clamp your vessels, and then you've got this sliding feature, which is quite important and quite useful, in as much as you can put your vessels in there, and then you can slide the vessel ends to the optimal distance for anastomosis. It's important that when one is doing that, is you don't put too much tension on the vessels, so that when you release the clamp, the anastomosis are actually under too much tension. You can see a wide variety of sizes, from very tiny to much larger, and they have obviously much larger ones as well. This one is an Ackland clamp, and this one is different from these in that it's got this wire frame around it with these two things called cleats. And the whole purpose of this is that when you're working without an assistant and you put your sutures through, you can leave the suture ends long and wrap it around this, so it acts as an assistant, which is essentially holding the vessels open. Very useful when you're doing triangulation technique or such like. So it just acts as a sort of static assistant, if you would. Now the other difference between clamps are A clamps and V clamps, and A stands for artery and V for vein, if you would. And the difference is that all V clamps can be used for arteries and veins, but arterial clamps, for the A clamps, are used for much bigger arteries, thicker walled arteries, and at the tip, while this doesn't partially have it, but even at the tip they're sort of curled in, and that's to prevent too much crushing of the vessel, and also to prevent the vessel from just slipping out. So it's a little like a parrot beak, if you would. Okay, so those are the A clamps and V clamps. Now all of these clamps are metallic, and they're reusable because they can be autoclaved. Now there are these new clamps that have been brought out, these are ones like Mercian, which are all disposable microvascular clamps, and they are single clamps and they're double clamps, as one can see. Okay, and the interesting thing about this is they all got these little numbers on them, and they are grams per millimeter square, and that refers to the clamp closing pressure. And the closing pressure is the force applied by the clamp. This is 15 grams as opposed to 120 grams over the size, the maximum width of the vessel. So you can see from that, the larger the vessel, the less that this will give a closing pressure, or conversely, the smaller the vessel, the greater the clamp closing pressure would be for a particular force. So if you have the 15 grams per millimeter square, the pressure to give on a small vessel would be a lot more than to give for a larger vessel. Important to realize that, and that's why we use the smallest clamps we can per vessel. The other thing, of course, veins are they're more prone to injury than arteries, and you want to use the less closing pressure. Now finally, if you can go back onto these metallic clamps, a lot of these SNT clamps have these little lines on them. As you can see, maybe there are 4 transverse lines on each limb, and what the lines denote is that the smallest vessel width that you can use is between the 2 middle lines, and the largest vessel width will be within the 2 outer lines. So if you stay with the vessel that is this size, between the smallest one to the bigger one, then you're fine. But if you go any bigger, it will not hold it. If you go any smaller, you need too much pressure on the vessel itself. So that's the microvascular clamps, and this is of course the clamp applicator.